Rotator cuff repairs can be accomplished via an arthroscopic or an open approach, and the decision on how to fix each rotator cuff is one that we make based on patient characteristics and factors such as tear size, tear pattern, tissue quality, and more. In my hands, I think more than 95% of all rotator cuff repairs are done arthroscopically because I get better visualization of the soft tissues. I have more sites of manipulation of the soft tissues, and I often find I can get a superior rotator cuff repair through an arthroscopic technique. Of course, it's nice, it's less invasive, it's more soft tissue friendly to work through small poke holes, but at the end of the day, the point of this surgery is to get an excellent rotator cuff repair. And to that end, if a patient's tear characteristics merit consideration of an open rotator cuff repair, I won't hesitate to convert it to an open, and I still believe we will get excellent outcomes either way.